Hi, welcome to Your Life, Your Choice with me, Allison. How could I have not one aneurysm, but two? Anyway, so the mystery was, why do I have the aneurysms? So the next day I went for more tests, and of course I had a lot of blood work done, and everything has come back as great. I mean, I have the most amazing blood work in the world. So the long and the short is, we're into an exploratory mode of why do I have this? And so I'm going to do this daily, weekly video blog to document what's happened, as well as to share with the world, because when I went to the literature, I couldn't find anything on a fusiform carotid artery aneurysm in people my age that don't have high blood pressure, that don't have atherosclerotic disease, that don't have any of the risk factors. I don't smoke, I don't drink excessively. The only risk factor I have, which isn't even a risk factor, it's possibly an association, is I have Hashimoto's, which is thyroiditis. But that's for another discussion. So I'm having my surgery on Thursday. They're going to go in, they open you up here. I don't know exactly how they do it. I'm not asking too many questions. I'm trusting, because this has fallen into my laps, and the way that the diagnosis and everything is just unrolled, I'm going with it. I'm not really scared, because I know it is a life-saving surgery. If the aneurysm was to burst, I wouldn't have a very good chance of survival, and if I did, it wouldn't be with great quality of life. So this is a life-saving surgery. And I'm very grateful, so grateful that I was my own best advocate, and that I didn't take the anti-inflammatory and wait and follow other people's advice. So there's a couple of messages to take home here. One, be your own advocate. When you go to the doctor because you think something is wrong, there's something wrong. You know, we're not just hypochondriacs. We're not walking around. Oh, sorry, just a little clarity. Last year I had an MRI on my neck because I had this chronic neck pain, and the aneurysm was there, but it was not diagnosed. When they went back this year, they looked at that MRI and they were able to see that the aneurysm was in fact there, and that it is in fact growing, which is why I'm having the surgery on Thursday and not into a watch and wait and see type of mode. But the point is, last year, the doctors said to me it was in my head and I was depressed, and they wanted to put me on antidepressants, and I knew I wasn't depressed. So I went on my own route, and I went to a chiropractor, and I've been doing massage, and I've been taking turmeric tablets. And there's a message. Like I said, be your own best advocate, because doctors, sometimes they're really good, but sometimes they're not. And sometimes they have a preconceived notion, and only you know what you're feeling. So if you really know in your heart of hearts that something isn't right, that the pain or that the lump or the bump isn't just nothing, then be your own best advocate. Anyway, to keep it short, it really is our life, and we are the best advocates for ourselves, and we know ourselves better than anybody else, and we let other people talk us out of things that we know are true. And so we need to listen to that inner voice, and I am listening. Oh my God, I am so open and listening to my inner voice, and I want you to listen to your inner voice, because that inner voice could save your life. Whether it's about a medical issue, or whether it's about, don't get in that car with that person, they've had a few drinks. Or, yeah, no, my friends want that pizza, but I know it's not what I need right now. So just listen to ourselves. Anybody out there has any information on why people get multiple aneurysms when they don't have any other associated risk factors, please email me. Leave a note below and I'll get back to you. I really need help here, and the doctors don't have the answers, and I need help. So please share this. Ask your friends, ask your doctor friends. Please try to help me to solve the puzzle of why I'm getting aneurysms in my head. Is it that I have an inflammation response? I don't know. Please help me to solve this. Probably the next time I come to you will be from the hospital with an update, and you know, keep positive. We get one shot at this life, and it's not always going to work out exactly as we had wanted, and we don't know how it's going to unfold, but for sure we do get to choose how we feel about how it unfolds. I could be crying in a corner, and that wouldn't serve me, my family, or you. Thank you very much for your time. I hope you have a great day, and remember, it's your life, your choice. With Allison. Have a great day.